Hello, Miss Taylor. My name is Eva. I'll be your nurse today, and we're going to perform a cranial nerve examination. How are you doing today? So the first test that we're going to do is we're going to test your cranial nerve 1, or the olfactory, okay? So if you close your eyes, okay, close your eyes. Okay, the patient has closed her eyes, and I'm going to let you smell this, okay? And tell me what this smell is. It's peaches. That is correct. It's peach aroma therapy. Now, the second test that we're going to do is called the Cranial Nerve 2, and we're going to test the peripheral visual field. So what I'm going to have you do, you're going to close one eye like this, and I'm going to close my opposite eye, and I'm going to show fingers in front, and you're going to tell me what you see. 2, 3, and now we cup the other opposite eye, okay, and I'm going to cup the opposite eye, and we're going to do the same thing. What do you see? 1, 2. Good. So now we're going to proceed to do a visual exam, okay? So tell me which line can you read comfortably. Line 8? Okay, good. Can you read it for me? D-E-F-P-O-T-E-C. Okay, that means you have 20/20 vision. Next, we're going to check the cranial nerve 3, the oculomotor, cranial nerve 4, the trochlear, and the cranial nerve 6. And in this test, Mrs. Taylor, we're going to look for shaking of eyes, called the nystagmus, in 6 cardinal fields, to see if there's any shakiness in your eye, okay? Just looking at your eye right now, I kind of see a little shakiness, but we're going to test it, so don't worry. Do you have any questions at this point? No, I'm good. I'm good. Okay, so here we go. Just follow my finger. Okay. Okay, good. Now, I'm going to dim the light a little bit, okay? I'm going to dim the light, and we're going to look. I'm going to look in how your pupils dilate, okay? Just follow the light, okay? And on this side now. All right. And the pupils should dilate. And they did. The next test we're going to do is we're going to check for accommodation. And I'm going to move this object towards your nose, and we're going to see how your eyes adjust, okay? So here we go. Just look at my finger. Look at my finger. Look at my finger. Good. And the eyes have crossed. Good. Good, good, good. So now we can document that your pupils are equal, round, reactive to light, and accommodating, which is good news. Now we're going to test for the cranial nerve 5, which is the trigeminal nerve. And what this does, I'm going to ask you to clench your teeth, and I'm going to feel the masseter muscle, okay, the masseter muscle right here. It should be a nice lump muscle, and try to open your mouth against resistance. And I can see you can do that. Okay, good. Next, we're going to check for Cranial Nerve 7, the facial nerve check. I want you to close your eyes for me. Okay, close your eyes. Okay, you can do that. Good. I want you to smile. Good. I want you to frown. I want you to puff your cheek. And you were able to do all of the above. Okay. The next test that we're going to do is the cranial nerve vestibulocochlear nerve. And what I'm going to do for this test, I'm going to occlude one of your ears and whisper on the other side and tell me what you hear. Okay, here we go. So I'm going to occlude one of your ears, and I'm going to go on the other side. I'm going to whisper something and tell me what I told you. Today is a good day. Today is a good day. And we're going to do the same thing on the other side. I'm going to occlude your opposite ear, and I'm going to whisper something on this side and tell me what you hear. Today is Thursday. Today is Thursday. Good. Okay. The next test we're going to do is what's called a Cranial Nerve IX glossopharyngeal test. And it's not a pleasant test. It's not a pleasant test because it tests your gag reflex. Okay? And then we're going to do the Cranial Nerve X test. So for the Cranial Nerve 10, it looks like you have passed it because obviously you can talk and swallow. And for the Cranial Nerve 6, which is an accessory nerve test, basically we're going to move our head up and down to the side and shrug against resistance. Okay, I can shrug against resistance, so that works. And the final nerve is hypoglossal, and we can move the tongue side to side. And that concludes our cranial test.